I'd make it bigger.
Not yet. There's.
Okay.
Sure.
So
I'm going to mute everyone real quick so that everyone's on mute, and we'll only have the speakers up. Okay. Okay. Well, it's just after 5:30. This meeting is scheduled to go till 7. We have quite a few speakers. So I'm going to ask the town manager, Libby Gibson, to go ahead and get us started. Libby?
Thank you, Julia. I'm Libby Gibson, Town Manager. Welcome to all who are joining this session. Your time is valued and appreciated. For nearly 2 years now, the town has been actively reviewing and examining PFAS issues on the island. We have engaged professional consulting services and dedicated staff resources. We have regular communications with the Department of Environmental Protection, and we are aware that Mass DEP is investigating PFAS contamination detected at certain residences on the island to try and ascertain whether the PFAS originated at that property or migrated from somewhere else, and expect that Mass DEP's determination in that regard will impact who is the responsible party or potentially responsible party for the purposes of remediation. The town has filed multi-district litigation and is proactively seeking funds from the responsible private companies to assist in the remediation expenses for PFAS on the island. Tonight, we are sponsoring a panel presentation on state and town efforts, activities and updates regarding PFAS, as well as an update from the Nantucket PFAS Action Group. The meeting will be moderated by Julia Novak of Raftellus. We sincerely thank you for your time and participation. Julia?
Okay, super. Well, thank you all very much. We do have a pretty full agenda and we want to get started. Tonight's topic is PFAS in drinking water. And as the town manager mentioned, we do have a panel. Our speakers this evening from the town will be Roberto Santamaria, the Director of Public Health. We have a couple of representatives from the Commonwealth. Angela Gallagher and Fred Sivian will be speaking. And then Mark Willett from the water company will also make some comments, as well as a representative from the airport. After that, we'll hear from the local Nantucket PFAS Action Group. And so we will give them some time to present. And then after that, we will give others an opportunity to speak. If you have questions this evening, because we have a lot of participants and a lot of panelists, our plan is for you to put any questions in the chat. We will not necessarily address the questions this evening. We will capture all the questions that are in the chat, and we will work with the town to get those to them, so they'll be up with responses on the town's PFAS website. At the end of the meeting, after all the presenters that are scheduled, we will see how many people are interested in making a statement this evening and how much time we have left before 7 o'clock. And I will moderate the public comment so that we allow as many people to speak as possible and finish the meeting at 7 p.m. So look forward to your participation and interested in hearing what the speakers have to say. So Roberto, I'm going to turn it straight to you as our first presenter.
Thank you, Julia. Good evening. One of the things that we wanted to discuss here is, and thank you for all of you for joining. What the most important part that we want to discuss here is to be able to get the information that we've been collecting as a town, as a community, as a greater scientific community as well. We're trying to get as much information to you as possible. We know that over the course of the past few months, there's been a lot of questions about PFAS, what it means for the island, what it means for property owners, and where do we go from here. So what we're trying to do here as we move along is to hopefully answer these questions for you. And if you have more questions, please get it to us, because we are in this together. We all share the aquifer. We all live here. So what we are trying to be as transparent as we can. As we all know, we have been doing some PFAS testing across the island. Some wells have come back positive. Most of them have come in and non-detect, which is really great news. We have a great panel today who is running that program, who I will let them describe the program and where we are from there. Now, from a town's perspective, we are still in a fact-finding mission. And once we get a comprehensive view of where we are, we'll be able to really start moving forward on this. And with that, I will just bring it back to Julia.
Okay, well, thank you very much, Roberto. And so Angela Gallagher,
Yes.
it's to you.
Okay. Yes, I'm Angela Gallagher. I'm with the Mass DEP in the Southeast Regional Office out of Lakeville, Massachusetts. I am the Southeast Regional Branch Chief for PFAS. So basically, I'm trying to keep the PFAS sites consistent from one to the other throughout the Southeast region and kind of keep a thumb on top of what's happening. To make things complicated, I am with the Bureau of Wayside Cleanup, and it's the drinking water program, not the program I'm in that does the private well sampling that's also being administered, to make it even more complicated, through UMass. Fred Sivian is here, and he is with Mass DEP working directly on that UMass sampling program. I also have Paul Locke here. He's the Assistant Commissioner for the Wayside Cleanup, for Bureau of Wayside Cleanup for Mass DEP, and Sandra Baird, who works for the Office of Research and Standards, and she's here to help with any questions or issues regarding health risks and toxicology. So Fred did put together some slides. I don't know if you want to get right into that, Julia, or if you wanted to, if you had something else you needed to say. I'm going to jump in with any questions as Fred goes on, as will Paul and Sandra as needed.
Sounds good. We're going to share his slides. Fred, you are on.
Hi, thank you very much. Again, my name is Fred Sivian. I work for Mass DEP on this PFAS program. The most interesting thing to me about PFAS program is that it's an emerging contaminant. There's a lot that we do not yet know, we as a society, about PFAS and how it interacts with humans and how widespread it is throughout the environment. Go ahead, the next slide, please. There's a lot of work happening on Nantucket. That's interesting to me too, because there's some other towns in which we're conducting the private well program in which we don't have the level of work that's occurring in Nantucket. And just I wanted to make sure that people understood that the private well program is one important component of the work that's happening on Nantucket. To me, the most critical work, though, that's happening on Nantucket is being able to determine the extent of known contamination of PFAS on the island. For many other towns that are in the private well sampling program, the issue to them is to see if there's PFAS in the environment in their town. From DEP's perspective, the reason we're doing this program is to be able to determine, get some handle on how extensive PFAS is distributed across the Commonwealth. Next slide. So what we're going to talk a little bit about is what our PFAS, what the well sampling program is, potential sources and all. I also need to tell you that these slides are excerpts of slides that DEP is using for all the 84 towns in which we're conducting the private well sampling program. Our most common way we do this work is we get in touch with the Board of Health. We have a meeting with the Board of Health that covers these and some other topics and slides to make sure that the towns are apprised of the work that Mass DEP is doing. Next slide, please. So PFAS are polyfluoroalkyl alkaline substances. They are used extensively in manufacturing of consumer products. If you've got stain-resistant clothing, if you've used Teflon, if you've used those microwave bags that for which to get popcorn popped, then you've been using products with PFAS on it. I think that's the essential problem with PFAS is that there are thousands of these chemicals that are used in a variety of different ways that we've all bought, purchased, and used, thrown away. They're incinerated in landfills. When we wash our clothes that have PFAS on them, it's fire retardant, for example, for small children, that's put into our septic systems. And what we're finding out is that these substances are risky to humans, something we didn't have a good handle on back in the 1950s and 60s when they started to be used more. But we're understanding now more about the effects that they have on public health. We're trying to see how widespread they are in the environment. Next slide, please. So I mentioned these sources of PFAS. Need to say that the EPA recently, as of a couple of days ago, described work that they're going to be doing to look at the chain of work that they will be doing to be able to address PFAS in the environment. Again, part of the problem with PFAS is that it's spread to a variety of different places from a variety of different sources. What EPA is doing is now looking at the life cycle of PFAS, the thousands of PFAS chemicals. They're trying to get upstream of the problem. They want to focus on preventing PFAS from going into the environment in the first place. They're also trying to find a way to hold polluters accountable for the work they've done and to be able to invest in more science to be able to figure out the gaps in our understanding of PFAS, how it affects human health, how it migrates through the environment. All those things are part of the EPA study of emerging contaminants. Next slide. What this confusing chart shows are the different ways in which one can get exposed to PFAS. I live in the town of Dedham. We have a public water supply. Our public water supply is contaminated with PFAS. It's at about 14 parts per trillion. That's below the state's action level of 20 parts per trillion. But that's the primary way in which I get exposed to PFAS. There are other ways to get exposed to PFAS too. They can come from incinerators, they can come from factories, they can come from clothes that we wear, they can come from exposure to a type of fire foam that's used. There's type A and type B firefighting foam. Type B firefighting foam, which is used for intense fires, is the kind that contains PFAS. So I think part of the essential problem here is that it comes to us from a variety of different ways. That being said, the most common way for people to get exposed to PFAS is through drinking water, which is why Mass DEP has been concentrating on having testing at all the 1,600 or so public water supplies around the Commonwealth. That testing started last October, and why we're started testing of people that have private wells in 84 towns across Massachusetts. Next slide. This slide recaps some of the potential sources of PFAS. When DEP, the reason why we're looking at these 84 towns across the Commonwealth, which includes Nantucket, we're looking at towns that are more than 60% served by people's drinking water is more than 60% coming from private wells. It's about 500,000 people we figure in the Commonwealth that drink water from private wells. We're looking at these 84 towns. And as we look at these 84 towns, what we're trying to do is to sample a selection of wells in each of the towns from 20 to 40 locations in each of the towns to try to get a sense of how widely PFAS is spread through that particular environment. When we do so, one of the things we do is look at whether there are places in town that may be associated with potential PFAS source areas. And that's what this slide indicates. If there's a town that has, for example, a junkyard or that has a landfill, we may have some of those 20 to 40 locations be selected to be close to those potential PFAS sources. Next slide. There are a variety of ways in which Massachusetts State is addressing PFAS. We've talked about money that's available to test public water supplies. We're also testing private water supplies too, private wells. There's also money set aside to go to public water suppliers. So if they do discover PFAS in their public drinking water, they can have a source of some funds to be able to address those. The next to last bullet here, I need to point out that Massachusetts DEP has established what's called a drinking water standard for PFAS. It's 20 parts per trillion. Compare that to a federal guideline, not a standard, but a guideline of 70 parts per trillion. The Massachusetts standard is, we believe, more protective than that standard, than the guideline that's been adopted at the federal level. Next slide. So we're sampling in 84 communities. With private wells, the local boards of health have the authority to regulate private wells. Mass DEP doesn't have any direct authority to regulate private wells, and that's why we're partnering and working with boards of health, with town officials and UMass to do this testing program. What we're hoping to get from that program is to be able, from the 20 to 40 wells across the 84 towns across the Commonwealth, is to get a better idea of how widely PFAS is distributed in the Commonwealth and whether it's associated with particular land uses. For example, we could do some testing around junkyards, for example, in some towns and find PFAS. In other towns, we wouldn't find PFAS. So just as a hypothetical, we'll use that information to try to determine if there's some association of particular land uses with PFAS. There are already towns in the Commonwealth, Stowe, Boxborough, Nantucket, where we know that PFAS exists in the environment. And that work of being able to find out the extent of known contamination is work that the Mass DEP's Bureau of Waste Site Cleanup does, our 21E program. That's important and critical work. And the best way to think about this, the private well program, is it's working in tandem with the work that our waste site cleanup program is doing. In some instances, we've found detections of PFAS through our private road program that are high enough to be able to alert our Bureau of Waste Site Cleanup. In Nantucket, we have test results, last I looked, at 24 different locations. This is from about data from about a week and a half, 2 weeks ago. For 16 of those locations, we have non-detect for PFAS. There were 2 locations out of the 24 that were above that action level, the standard of 20 parts per trillion that I mentioned earlier. Next slide. So how are we choosing sampling sites in Nantucket? And it's particularly difficult in Nantucket because there's so many people that have sent in requests to be participating in the program. I've mentioned that we're testing 20 to 40 locations in 84 towns. In Nantucket, there are literally hundreds of people that have asked for their wells to be tested. We don't have the resources to be able to do anywhere near that many. We have sent information out to, requests out to landowners to have them return forms to participate in the program. And as happens in other towns, most people return those forms. Some people decide not to. So we have a rolling process to try to get up to the 40 sites in Nantucket. This slide just shows some information about where we pick sites. Some of the sites end up getting picked randomly. Some of the locations are picked randomly to make sure we've got good geographic distribution. That relates back to the core reason for the private well sampling program, is to try to characterize the extent of any PFAS contamination across the Commonwealth. Next slide. So how does a property owner sign up? Sign up and go online. This is, in fact, we've had some difficulty in some western parts of the state where people don't have online access and have frankly been frustrated that they haven't been able to use, that they've been forced to use computers or smartphones to be able to sign up for the program. But basically what happens is we determine the wells to be included after consultation with the Board of Health. We send a program acceptance letter out to the private well owner, and then a sampling kit is set. This sample sent out to the owner. The sampling is done by the owner themselves. There's a cooler sent out. that has sampling bottles in it with instructions about how to take the samples. The homeowners do that sampling themselves, pack up the cooler, arrange for the coolers to be picked up through our system of using UPS and other sorts of companies like that to be able to get them back to the laboratory. Then the laboratory completes the testing. The mentioned earlier, Massachusetts testing is for down to 20 parts per trillion, and that's for the sum of 6 different kinds of PFAS chemicals. As I said earlier, there are thousands of PFAS chemicals. The federal guideline of 70 parts per trillion looks at 2 of those thousands of chemicals. Massachusetts is looking at 6 of them. Other states are looking at different combinations of them. And I think the issue for EPA is how are they going to get a handle on the thousands of PFAS chemicals that are out there. We look at the first set of 6, 10, 12, however many there are. There are other chemicals out there in the same chemical families that may have the same chemical problems. We need to get a handle on that. Next slide. So we confirm with the well owners, we send the sampling kit, the owner takes the samples from their tap. We have a video that shows how to take the samples. It's simple enough so that people like me, I'm not trained as a scientist or an engineer, are able to go ahead and do the sampling. As I said earlier, that when I checked the public website that has results for Nantucket, of the 24 sites that were there, 16 of those have been non-detect so far. Next slide. When we get those results, we share those with the private well owner, with the local board of health, and of course with the drinking water program. If the PFAS is detected above the standard for Massachusetts of 20 part per trillion for the sum total of any of those 6, we also tell our Bureau of Waste Site Cleanup. Our technical assistance providers call every homeowner who has a detect over 20 parts per trillion and walk them through the process of what they would do after finding out this information. If their initial sample is the detect above 20 parts per trillion, we always ask to do a confirmatory sample. We want to make sure that the information we're getting from the lab and from the well water is accurate. There's always some fluctuation in values that comes with any kind of testing. We want to make sure that we're sure. If the confirmatory sample comes back and it is confirmed to be over 20 parts per trillion, then we have discussions with the well owners about what their next steps are. And that includes deciding whether or not to get some treatment at a private well. I think the difficulty that people have with private wells is there isn't, unlike public water supplies that are paid for by ratepayers, where we group together to try to get that water into people's homes, private well owners own and are responsible for operating their own wells. So I think sometimes private well owners can feel a little bit at sea in not being able to know what the next steps are. That's why our technical assistance providers are there to be able to answer whatever questions come up. Next question, or next slide, please. So this slide gives a little bit of the information about what what our technical assistance providers provide. I think that the best way to answer the question, what do I do next, is for me to explain what I would do if I had PFAS over 20 parts per trillion in my water supply. What I would do is looking at getting either a whole house or what's called point of use water filter. Some people already have water filters for their water because of hardness of water, because they've got an excessive amount of sediment, for any other purposes. It adds an issue for anyone who's deciding to get treatment for their house. Carbon filters can be used very effectively to reduce PFAS. We know this for a couple of different reasons. There's a North Carolina study that looked at common countertop, under sink units that fit onto faucets that have carbon filter in them, and found those to be effective at being able to reduce PFAS and other contaminants, lead, for example. We know from our waste site cleanup program that on a massive scale, on the scale of testing with public water supplies, have found that carbon filters giant vaults of them are also effective reducing PFAS. So what I would do if I found PFAS in my water supply is I would see about getting either a whole house or a countertop. I already have a countertop unit that I use with that has carbon filters in it. I use that. I haven't tested for PFAS in my house, but that's the approach I would take. Next slide, please. This is the last of my slides here. I wanted to come back to where I started, which there's a lot of action happening on Nantucket, a lot of people doing a lot of work, mostly around the issue of determining the extent of known contamination on Nantucket. What I'm hoping is that the private well program, which is looking at the extent of contamination across the Commonwealth, we'll be able to add information that the town can use and that DEP's waste site cleanup program can use to better determine the extent of contamination and best how to be able to deal with that. Angela, Julie?
Thank you very much. Appreciate your presentation. And Angela, did you have any final comments?
Nope, I'll just wait and see what anyone else has to say or ask.
Sounds good. And we are capturing, there was one question from, we're capturing it and we will make sure those get responded to over time. So we had anticipated a presentation from Mark Willett from Wannacomet Water. Is Mark here? Let's see, I don't see him. All right, so I'm going to go ahead and go to Noah Carberg from the airport, and he has just a very brief presentation of kind of what they've learned out at the airport.
Okay, thank you, Julia. So I just have a few talking points for the presentation. Now, as an overview to the airport's investigation, the airport's taken 462 samples now from 77 private wells and approximately 400 soil samples in support of our study. Recently, the Airport Commission has approved through a task order with McFarland Johnson utilizing Weston Solutions for an additional source area investigation. This will provide $495,000 for plume investigation and additional on-airport sampling and monitoring. That work will take place this fall and winter. The Airport Commission will also be reviewing a policy amendment at their November meeting that would continue to provide bottled water service for affected residents until the water main and the associated water services are commissioned. The water main project, this is where the airport is installing, I believe the number is about 12,000 feet of new water main. We have an anticipated November 15th start date. Dialing into exactly around this date has been a little bit difficult due to supply chain and shipping issues, but we now think based on that schedule, we'll begin on Matacasham Valley Road and then move west along the water line. There should have been an announcement in today's paper. There will be additional announcements and subsequent editions. We'll distribute flyers to affected residents, and we'll have upcoming meetings with officials to discuss not only the construction impact across the airfield, but also to make sure we have appropriate public safety access across the airport. I wanted to thank Robert Bauer, who will be our contractor of the town, and Wannacomet Water Company for their coordination. We also have outreach underway that should occur beginning tomorrow to residents to discuss the placement of their water service connections. Holgate Longfin, a local firm, will do the public side connections. Robert Bauer will do the private side work. Again, we want to thank them for taking on this work. It's difficult to find contractors in Nantucket, and especially Wannacomet Water Company for their coordination. They've really done a lot to help us with our project. Two more items here. The fuel farm construction project is underway. While this contains a lot of facility work, it also includes replacement of a legacy fire suppression system that was backed by a PFAS-containing foam. And all of that decommissioning work is taking place in coordination with our LSP. And again, if you have any questions on the airport's investigation, all of our results, public meetings, and material is available at eck-pfas.com. So thank you, Julia.
Thank you, Noah. Appreciate that. Mark will hopefully be coming later, but I want to go ahead and give Nantucket's PFAS Action Group an opportunity to present. So Aisha Khan is going to be the presenter. If you are not a speaker, if you would please mute yourself, that would be most helpful for us. And I think we had said, Aisha, about 10 minutes, so we're looking forward to hearing from you.
Hi, sorry, that took me a second. Let me just
No
pull.
problem. Glad you're here.
Okay, great. Let me just pull up my information here. And can you guys hear me? Okay.
Yes, we can.
Okay, great. Hi, everyone. My name's Aisha Khan. I'm co-founder of Nantucket PFAS Action Group. We were invited to give the community an update on the projects we've been working on. So first, I just wanted to start by saying that we're delighted that Mass DEP and University of Lowell are working together to provide the well testing program to get a better scope of PFAS contamination across all the towns in Massachusetts. We also wanted to point out for anyone getting those results back from the program, when they get their email, to make sure that they open up the attached PDF to get their full results of all 18 PFAS. Typically, only the 6 are written in the email, but you have to open up the PDF to get all of them, and that's around page 10 or so. So really from a community perspective, many times when a person finds out that they have PFAS in their well, that person wants to know, what is PFAS? Why is it there? How did it get there? And how do I limit my exposure? What does this mean for my health? So what we started to find out was in this process, a lot of clinicians have limited information on this topic. It's not really environmental, exposures and toxicants aren't some really stuff that is often given much attention. So, and because of that, they're really limited on how to monitor and treat highly exposed patients with PFAS. So we work together with the Nantucket Health Department and the Nantucket Cottage Hospital, supported also with the town of Nantucket, to partner with a group called PFAS Reach. PFAS Reach is funded by National Institute of Environmental Health Services, and they're a group. They are Silent Springs, Northeastern University, and University of Michigan State University, and they are basically a group that provides online resource center to provide educational materials for affected communities and interpretation tools and data tools that can help you kind of get a better grasp of what PFAS is. And what I really like on this, that this group has done, is if you get your water results, they're pretty confusing and it's very difficult to understand what they mean and how to interpret them. So if you go to their website, depending on which state, you just fill out which state you're in, and then it will ask you all the information to fill out, and then it can visually show you where your results fall across, basically across other communities in town. So it's just kind of nice to visually see that. You can also do that with blood work. If you get your blood work, you can go to the site so you can see it with water or blood, but it's really, really a great resource. So we worked with them, and we will be, they've created clinician guidance documents, and they will be presenting that to our employees at Nantucket Cottage Hospital. It just so happens that the timing worked out nicely, that as the Mass DEP program will end and people will get the results, hopefully the goal is that our clinicians and our doctors will be prepared for when people have questions, they can go right to them, and they'll have adequate information to give them. So that was one thing. And then the other thing was there's a bunch of resources, and we have them listed on our website. If you go to pfasactiongroup.com, you click on the menu page, you can just click on the PFAS on Nantucket, go to the drop down, and right there it says local news and information. And when you click on that, it'll have all of the sites that I'm talking about. And it's got other great resources, like Rhode Island University has a STEEP Superfund program. The Green Science Policy has a great website. So a lot of resources. if you want to look beyond, Mass DEP and CDC, your typical standard places that you would start, you can just continue to look at other sources too. So the other update I wanted to give was on Tuesday, we were asked by the state senator, to testify at the 9th meeting of the PFAS Interagency Task Force. And we presented there, and some of our takeaways, basically the main takeaways, I just wanted to share that with everyone today, was these were some of the main things we wanted and goals we wanted to do. And I just wanted to share them with everyone here today. So what we presented to them was a bunch of asks, and I'll just go through them really quickly. So we would like PFAS as a class. We'd like to use a class-based approach for the entire life cycle. We cannot afford to look at these chemicals one at a time. When these compounds are persistent, some are mobile, and some have significant exposure and toxicity concerns, we'd like them to look at as a class-based approach. This is not a new concept. It's been done with contaminants like dioxin and PCB. Hold the corporations and individuals within the corporations accountable. Pass PFAS legislations. This is, again, more on the state level, but I think it's important for everyone to hear. Pass restrictions on PFAS in food packaging, textiles, carpets, AFFF, firefighting gear, artificial turf, personal care products, cosmetics, and all other non-essential uses. That's really what we want to go for. Also providing financial support to towns and communities for funding for education, awareness, remediation. And we really truly feel that these things should not be falling on the taxpayers. It really should be a polluters pay type of situation. Provide education to healthcare providers and our health departments, documents like PFAS Reach, already described that in the webinar. Learn from the experts and work with academics, doing research, things of that sort. Provide funds for statewide research, awareness, education, remediation, and expanding testing. Support cost internalization programs like TURA, which is the Toxic Use Reduction Act. Offer blood testing for PFAS impacted communities and highly occupationally exposed. And then finally, we feel, again, this is more catered towards the state, but we all live in Massachusetts. We feel that the state of Massachusetts should consider entering the lawsuit against the manufacturers and distributors of PFAS. So that's what I have.
Okay, thank you very much. I know Hap Cooper had raised his hand. I've asked you, Hap, if you have a question, you can put it in the chat. And we're going to be asking people to speak later on in the meeting. So thank you. And thank you, Aisha. Appreciate your input. Okay, I'm still, Mark Willett had another commitment and he is going to try to get here. I knew we knew apparently that he was going to be a little bit late, but I don't see him quite yet. So at this point, Fred Sivian, I think, had another something he wanted to share. So Fred? You'll have to take yourself off mute. There you go.
I'm off mute. Yeah,
there
if I
you
can
are.
share my screen. I was Ms. Khan's presentation reminded me that there's a variety of information that people can get, and I wanted to show some examples of those. So hopefully my share screen will work here.
Okay, drum roll, please.
Yes, let's see how this goes. Okay, this is one of the fact sheets that we use here at DEP to be able to explain what's happening with the PFAS program. There are a variety of different fact sheets, some about the public program, some about the private program, some have information for consumers. So I just wanted to urge people to be able to use those resources in addition to the other resources that were mentioned earlier by Ms. Khan. There's also a, let's see if I can get to this here. Let's make some room. We also have what's called a story map. It's basically an interactive map that contains information about how the private well program is doing. We also have this same map for public water suppliers in Massachusetts too. So I noted earlier that there were 84 towns. This shows information, this is all available to the public, that we're currently testing in 53 of those towns. So you can see it's spread across the state. There are some states that are some cities that are currently not being tested. They're not being selected to participate in the program. There are other towns like Nantucket that has been selected and where testing is currently occurring. There are other towns that have been selected for the program, but we haven't begun doing any testing yet. If you click on the results button, you'll be able to find the results for each town. When I said earlier, there were 24 results. We update these about every 2 weeks. So there is a lag period in between the time that an individual will get their results and the time they show up here. But I wanted to show people that the results are arrayed for the town. Nantucket, that wasn't a result that was above the 20 parts per trillion action level. We've been in contact with the homeowner about that, and basically giving them their services through our technical assistance providers. There are other places where there have been non-detect, other places where you've had detects between 0 and 20. So I just wanted to urge people, if they wanted to get a handle on what's happening in their town, particularly compared to other towns, this would be a good place to go. I reached this by Googling Mass DEP private well testing. What I'll do after this presentation is send the link for this particular story map and for the other FAQs that we have to Julia, so that they'll be able to be included with the other information that's available.
Thank you. Fred, do you think you could put the link to the place where people can apply for private well testing in the chat? I think that would be of interest to people, and then it would be easy for them to access it. If you have that handy, just pop it in the chat for us, okay?
I'll look for that. My reaction to that is that we have over 300 people that I've already applied for private well testing in Nantucket. We're again trying to get to 40. That being said, it's useful.
It doesn't sound good, Hap, if that's what you're looking for.
It's useful to show demand for the services.
Yeah,
so
exactly.
Let me see if I can find that link.
Okay, well, Hap Cooper was interested in it, and if we can provide it, great. He could be 301, so we'll see how.
I might be geographically desirable.
There you go. You never know. You never know. All right. So now what I'm going to do, I don't think Mark Willett has been able to join us. And so yet, unless this is we just had someone join us from the waiting room. Mark, is that you? All right.
Yes, it is.
Oh, well, that is what I call just in time. We're so glad you could join us, Mark. And we want to give you an opportunity to go ahead and address the group. We had some great presentations, and we're appreciative of you sharing what Wannacomet Water is doing as well. Thank you.
So we're following our required PFAS sampling program through Mass DEP. The Sconset wells were sampled earlier in the month, end of September, early October. We're still waiting for results on those. What's kind of happening at the labs is we're not the only community doing all this sampling right now. And it's taking 3 to 4 weeks sometimes to get the results back. So hopefully we'll have Sconsets back soon. Wannacomet's last round of sampling was same as before. All wells had no PFAS 6 detected, except for the one well, our backup well, which came in at 7 parts per trillion. That well is not online. We're not pumping it. That's an emergency backup well only. And we're in the process of drilling and installing a new well to where 15 would really be in case of strong emergencies. And if we ever had to turn 15 on, what we would do is blend it together with other wells so it would never be pumping by itself to dilute the 7 parts. Other than that, we've been very fortunate at Wannacomet for all of our wells so far to be clean. And Sconset, I have a good feeling about Sconset. We should be fine there too.
Great. Thank you. Thank you very much. And Brian, Fred, if you're still searching for the link, Aisha already put it in for us. So, oh, you got it now too. Okay. So Aisha is a great source of information as well. Mark, anything else that you wanted to share about things that the water company is doing?
We're just continuing to monitor. I've been
Okay.
talking with the commission a little bit about doing some additional sampling. Maybe closer to springtime, before we ramp up into the season, we might do additional rounds of PFAS sampling prior to the summer season. And then maybe one additional round in the middle, in the peak, when we're pumping a lot of water and the groundwater table is moving the most and we're depleting the table the most, to grab a sample at the peak. So maybe in the beginning and at the peak to get a better idea. So we'll probably do, on top of what's required, additional sampling.
Okay. And Mark, I might be wrong about this, but do I recall that you're also extending some water lines down in certain parts of town to provide water access to the Wannacomet system so people can get off private wells?
Yeah, so right now we're working with the airport on a project that was bid to get water out to Matacasham Valley Road, which will supply all of those 19 or 20 homes out on Matacasham Valley with town water supply. And we've been working with a small group of us in the town, have been looking at west of the airport and putting together some information and looking at some other roads west of the airport that we could potentially run water down.
Great. That's really helpful. Thank you so much. Okay, so what I'd like to do next is go ahead and ask anyone who might be interested in making a couple of minutes of public comment to go ahead and use the raise your hand feature and raise your hand so that I'll know who wants to speak, and we can make opportunity for that. So give people a minute to find the feature of raising your hand. It is if you look at the bottom of your screen in the reactions, if you click on that, there should be a little bar that says raise hand. Okay. So I feel like I've given folks an opportunity, and so I just have one person. So Hap, you get 3 minutes. This is your chance. So, and I'll have a timer going, but go ahead and begin.
I need 13 seconds.
13 seconds. I'll give you all 13 then.
I just want to make sure that I understood the first speaker correctly. If we use a Brita filter that's got carbon in it, right? And does that take out all the PFAS contamination?
Okay, if I answer that?
Yes, Fred, go ahead.
I can't answer that. We haven't done testing on the particular models, so we don't really know yet. What I was commenting on was that in general, carbon filters are really good at reducing PFAS. There are NSF certifications that are available by a federal process, where some units have been certified to reduce PFAS below the federal guideline of 70 parts per trillion. Some of the manufacturers have also conducted third-party studies that they have on their website that illustrate how effective their carbon filters are at reducing contaminants like PFAS and lead. There's also a study from North Carolina that looked at particular point of use faucet attachments under sink units and how effective they are. What Mass DEP and UMass are doing is beginning soon a point of use study where we're going to take refrigerator filters, countertop units, under sink units, and units that you hook on a faucet and see how effective they are at reducing PFAS, and then sharing that information with people. So it's a situation where I think some individual research is warranted, but it's possible, I know because I've seen them, to find water filters where have been both certified under the federal guideline for removing 70 parts per trillion, and they're also some of the manufacturers have third-party studies that show the effectiveness of reducing PFAS below those levels. Sorry for the long-windedness, but
thank you, Fred. Okay, Gary Gutt, I see you have your hand raised. And
Okay. Yeah, just a quick question. I don't know who to address it to, but do we have any information about where the 40 our test wells are going to be located around the island, or where the 2 that so far have been over the 20 parts standard, or any sense whether there's a locale focus either around the airport or around the landfill or someplace else?
Yeah. So I would appreciate it if people will put their questions in the chat, just because that way we'll be able to capture them and have them on the town's website. But if anyone has a quick answer to questions about the locations of the wells, that would be great. If we don't have it, just shake your heads and tell me we don't have it. So, and we don't have it. So Fred says no. Okay, thank you very much. All right, and then Peter McKay.
Hello.
There you are.
You
Yes.
got me. Okay, good.
We got you.
Very good. Thank you. I've been a resident here on Nantucket, west of the airport for almost 36 years. I had Weston employees come down and test my well. It was 12.3 parts per trillion. I've got cancer. My brother has cancer. My next door neighbor has cancer. My question, and I tried to put it in the chat, is if the wells were tested approximately 2 years after the airport stopped discharging the PFAS, why is it that this one-time figure, which even the own Weston employees, when they tested it, said this is just a moment in time. The numbers can vary tremendously day by day, particularly after rainfall. Why is it that these numbers in the one-time test are given such credibility that they are the de facto permanent numbers? I've been consuming, my wife's been consuming, my children's been consuming this water for over 30 years plus that it's been discharged. Yet, since we only achieved a 12.3 2 years after, no remediation is being done for us. So that goes against every scientific research that's out there. It only seems to me as if this is a fiscal CYA thing. I appreciate everything that's being done thus far, and I recognize the need to pursue more, but this is a common sense thing. And I don't understand why we've reached such resistance when this has been brought up to the local officials from the airport to the town before.
Okay, thank you, Peter. I'm looking for other hands, and I see that Aisha is providing some additional information about water filters in the chat. So I hope you all can see that, and we'll have that as when we put the Q&A together for a follow-up to this meeting. Is there anyone else who wanted to make a comment this evening? Okay, we'll see none. I'm going to give you a couple of minutes of time back. We really appreciate you attending and really want to thank, we could all clap for our presenters from the Mass DEP and from the town, from the water company, from the airport, and of course, Nantucket's own PFAS Action Group. So thank you very much. Oh, look, Haps even got the hand waving saying, good job, folks. So we appreciate you and we hope you have a good evening. Thank you very much.